One important aspect of work on healthcare quality focuses on measurement. If we can create measures of quality, then those measures can be used to identify issues that need attention, inform patients, providers, and others about quality, and guide our efforts for improvement. As a result, building and using quality measures has become a central component of efforts to improve quality, and we should look into some of the basic aspects of quality measurement. When we talk about measuring quality, one thing we always need to keep in mind is whose quality we're measuring. There are some common areas of focus. One is providers. One could measure the quality of a hospital, for example, or a physician group, even in theory, an individual physician. Another area is intermediaries. We could measure the quality of a health plan, for example. And a third, more generally, is population measurement or measurement for larger groups of people. We could measure the quality of care provided for all the patients in a geographic area, for example, or patients with some particular health condition. There can be some others too. There are different benefits and challenges depending on what we focus on, and things that work well for one may or may not work well for others, so we always have to keep in mind the objectives when we come up with and evaluate measurement approaches. A very commonly encountered framework for thinking about quality measurement is structure, process, outcome. The first level is structure. This emphasizes the context within which care is delivered. Does the healthcare system have a structure conducive to delivering quality? There are many measures of structure that can be and are commonly assessed. The general kinds of things are whether there are enough providers in the right places with the right needed training and skills, is the right equipment and infrastructure in place, are personnel and infrastructure organized and financed in ways that enable them to work effectively. At the level of a medical practice or a hospital, here are some structural measures you might encounter. Is there a good EMR or EHR system in place? Can it interact well with other systems, for example? Is there an ability to manage medication order entries or communication with pharmacies? Can an organization document that they have emergency protocols in place? Can they show they have a protocol to prevent the spread of infections? Are the physicians or other providers appropriately credentialed? Physicians and many medical professionals need licenses and can get certifications. Are all the personnel trained, licensed, and keeping up on the certifications? Are the facilities accredited and licensed and certified appropriately? Government organizations or others often provide indications of the structural status of institutions. Is their equipment up to date and of good quality? These are the kinds of structural measures that you'll encounter. For a health plan, or even at a broader population level, we might incorporate some of those aspects, but some would be different. And for example, there might be other measures that we would use, like physicians and professionals. Are there enough physicians and professionals for the population being served? Are there enough hospital beds? Where are they located with respect to the population? Things like that. Data used for structural quality measurement can come from a variety of sources. Sometimes one might use surveys of organizations. Sometimes there are regulatory filings or other administrative data that report on the characteristics of organizations. An example might be data from certification or licensing actions. And sometimes even other places have data. It's a pretty wide range. Structural measurement is pretty commonly done. Often when you look at different measures, the more structural ones look like the easiest ones to construct. At the same time, they may be the furthest from actual health outcomes, which is mostly what we care about, so quality measurement these days often goes beyond just structural quality.